Hello, everyone. Welcome back to community briefing. We'd like to kind of provide an update for you and like to welcome Dr. Laird with us, our Chief Medical Officer. And just to give you a bit of an update on what's going on, a little bit of a check-in, so to speak. And also maybe just to give you a little bit of positive news. We continue to have babies here at Orange City Area Health System. It's a very important part of what we do. It always amazes me, quite frankly, the number of zip codes involved in that. Typically every year we have around 35 different zip codes that are representative of the area, and 35, yeah, that's the right number. So that's a big deal, and we're very proud of that fact and continue to do that. One of the things that you need when you're delivering babies is doctors to be able to do that. And speaking of that, we do have another physician joining us this fall. Dr. Tyler Faber will be joining us. You can actually schedule an appointment with Dr. Faber now by calling 737-2000. Very anxious to have Dr. Faber join us again. It's a local Northwest Iowa boy, and strong roots in the area, and we look forward to a long relationship with Dr. Faber. Also this fall, we're going to be reintroducing ourselves to Dr. Josh Locker, who will be joining CNOS and providing orthopedic coverage to Orange City at least 2 days a week. And so we're very interested in take care of all of your orthopedic things, and specifically sports medicine related. And Dr. Locker, we have to figure out how to refer to the Dr. Lockers in our area, so because we're going to have a number of them. But Dr. Josh is particularly trained in sports medicine, having recently completed a sports medicine fellowship. And so we're very anxious to have him join us as well. Speaking of Lockers, we also have Dr. Dan Locker that will be joining us a year from now and joining his dad, Dr. Steve Locker, in terms of the general surgery rotation that we have. And Dr. Dan will be here full-time, practicing with his father and Dr. Nijkamp as well. So that's just a couple things on the good news front in terms of what's going on at Orange City Area Health System. I'd like to, because there were some things over the weekend that happened in a neighboring state, and Dr. Laird will talk about that in just a second. I wanted to give you a little bit of an update and take the opportunity to review a few stats in Iowa that you may or may not find interesting. First of all, in Sioux County, the 14-day positivity rate, and again, when you talk about positivity rate, you're talking about the number of positives divided by the number of tests. And so when those numbers are small, there is a tendency to fluctuate a little bit and move all over just because of the small number involved. But in any rate, the 7-day positivity rate for Sioux County is 0.8%. So again, that's 0.008 for you mathematicians. And that's obviously very low, less than 1%. The 14-day average for Sioux County is 1.2%. So again, very low, probably not a surprise to any of you. The state of Iowa for the 7-day rate is 2.6%, so still very low, and a far cry from the days we were talking about 30+%. And the 14-day rate in Iowa is 2.4%. So that's kind of where we are, and those numbers are, you know, they're worth looking at, but you can't take too much stock in them either. One of the things that I did find interesting, and I did talk to Dr. Laird about this a little bit, when we look at Sioux County stats, 47% of our positives over the last 7 days have come in the 18 to 29 group. And so that kind of makes sense. Maybe those folks weren't vaccinated or as aggressive with it. Statewide, 28% of the positives are representative of the 18 to 29 group. Interestingly enough, back in Sioux County, 26% are in the 0 to 17 category, which clearly is a category we didn't emphasize in vaccinations. On the positive side, only 9% of those positives were in the 60 to 69 group, and even more positive, only 1% of the positives were in the over 70 group. So again, an area that we really emphasized was the over 60 crowd, and that appears to be bearing some fruit at this point as well in the positivity rates. Region 3, one of the things we were looking at before there, of course, was all the hospitalizations in Region 3. There are 8 hospitalized patients today in the 20-county region in Northwest Iowa, 4 of them in the ICU, and 2 of those 4 are on ventilators. So again, this is still out there. It's still very real. And so we simply want to make folks aware that things are still out there, and to encourage vaccinations. And we'll talk about that a little bit more. But one of the things I teased you with earlier was what's going on in Missouri. And I'll let Dr. Laird maybe talk a little bit about some news articles we've been looking at, and particularly that came to my attention over the weekend. Dr. Laird?
Yeah, thank you, Marty, and say thank you so much to yourself and all the efforts that have gone into recruiting good doctors for the Orange City Area Health System. As a consumer at my age, as well as being a physician, it's good to know that that next generation is being cultivated and brought forward. So thank you so much to you and all those involved in bringing those folks here. Unfortunately, Missouri gets to be the leader in a category nobody wants to be, and that's leading with the most coronavirus cases, at least per capita anyway. They've had quite an uptick here in the last week or so. And of course, the question becomes why them, and what's happening there. And I'm not sure we know everything yet. When it's early on, it's hard for us to have all the facts together, but certainly one of the reasons appears to be the Delta variant, which has gotten some press and some news. The good news is it looks like the vaccines are pretty darn good against the Delta variant. It may not be perfect, but it certainly is good, and it's your best defense against it. And so there is some indication that the areas where vaccine has not penetrated very well, or been accepted very well, or rolled out, or whatever the case may be, is where they're really seeing a number of cases. And it does seem to be in the younger folks. It was a little hard to get an idea about how severe these cases were, and how whether it was resulting in a great amount of hospitalizations or ICU or those kinds of things. But certainly, as we know, if the older population has not chosen to be vaccinated and remains vulnerable to the virus, then those are the folks who may get hit the hardest. And so as we see these new variants, and now I believe I saw over the weekend, there's even a Lambda variant now. The good news is it appears for the most part, the vaccines are effective. We may not know yet against the Lambda, and it's still your best defense against getting a severe case of COVID. They aren't perfect. People can still get infected afterwards, but it appears to be much milder. Prevents the ICU usually, and hospitalization. So we believe some of that has to do with the fact that some of the areas being hit hard right now weren't necessarily covered well in vaccination.
And I think to follow up on that, Missouri, I believe it said, was 37th in the nation in vaccination rates, something like that. So again, the key take home is the vaccine doesn't make you bulletproof, but it even if you get it, it appears to lessen the impact, perhaps lessen the acuity of that.
And that appears to be accurate, and still certainly it appears to be much better. Even yes, there are side effects with the vaccine; those have been touted, both temporary, and of course there's concern out there whether there might be a few long-lasting ones. Those appear to be rare, but getting the illness is no picnic either. And just because we aren't seeing a lot of hospitalizations right here, which is wonderful and great news, please be aware it's still out there, it's still circulating, it is real. If you haven't been vaccinated, please consider doing so.
Yeah, and that was our point, that we still have plenty of vaccine. Again, we don't charge for the vaccine. That's something that has been given to us free. And so we do pass that along for an administrative charge. So this is not some, greedy pig, economic seeking hospital administrator money play. That's not what it's all about at all. It is about, this appears to be our best defense. And please take advantage of that if you have the opportunity. So the best way to do that is 737-2000, and we can get you hooked up for that. Some people have asked me, and I didn't know the answer of that until earlier today, but do we test for the Delta variant? And my understanding now is that all of our positives are being recommended to be sent to the state hygienic lab, which either does the variant testing or determines whether it's appropriate to do the variant testing. But nonetheless, that is occurring. And I believe over the last 2 weeks, the Delta variant was representative of about 50% of the positives in the state. So if some of you are wondering, is the Delta variant present? The answer appears to be yes, and probably at a rate across the state of in the 50% range. So it is here. Is there anything else to add on the Delta variant, Dr. Laird? Or
I don't think so, other than, again, what I've read so far indicates that the vaccine has pretty darn good defense against it. I'm not sure that it's been compared to the non-variant, but it appears to do a good job. And so if you've had the vaccine, you can feel confident that should you be unfortunate and get the coronavirus, that it should be a mild case for you.
good. Well, it certainly has been good over the last period of time, the weeks, to deal with life getting back to normal a little bit. Unfortunately, that's not always a positive thing, right?
Very true.
There are things that come up. I mean, so do you want to talk about some of the other things that are starting to rear their heads, so to speak?
Well, not surprising, as we get back together, as we travel, as we unmask in areas, things that maybe we don't have vaccines against start to circulate again. So we are seeing a significant uptick in RSV, or respiratory syncytial virus. Now that for very young, for infants, children under the age of 1, and particularly under the age of 3 months, can be very, very problematic. Most of the time it's not. Most of the time it's a bad cold. And for us adults who get it, it's usually just a bad cold that tends to hang on 2 to 6 weeks sometimes. But for the very, very youngest, particularly if they have any other health problems, it can be severe and cause hospitalization and even intensive care units. We usually see this in the late fall, early winter time, that this begins to circulate about the time that influenza hits us. And now we're seeing it now. Now, we didn't see it last fall, probably because we all were distancing, we weren't traveling, we were wearing those masks, all those things that kept us apart. But now the fact that we're getting back together, those viruses that tend to circulate are starting to circulate again. And so to some extent, we're catching up for what would have happened probably last fall to winter time, when that would have swept through. And we just happen to be seeing it at a little different time because we're getting back to normal.
Yeah, back to the good old days. And these things are normal in terms of occurring again. Do not merit shutting down the economy and wearing masks all over. But they're out there, and that's normal and to be expected. Just a comment also on, speaking of mask wearing and those annoying questions that you get when you go to a hospital and clinic regarding screening. I find them annoying when I'm on the receiving end of those, and I'm sure you do as well. Unfortunately, those will continue. As a healthcare entity, we are obligated with various regulations and things like that to continue that. We will do that. We do believe there is value in that, although maybe not as much as some regulatory agencies do. But we will be continuing to screen. We'll be continuing to require/recommend masking in some areas more than others, particularly the patient provider arena is an area that there are certainly reasons to do that. And keep in mind that back in the good old days, universal precautions were still a requirement. So there were times, and even back then, when masking was utilized and not required because it was the smart thing to do. And so, we'll continue to do that a little bit more than when we've done in the past, of course, and we'll continue with these policies. But I know it's frustrating. I know it's annoying at times to receive these questions, but please answer them truthfully, and then we'll just go about doing the things we normally do. So in terms of taking care of folks the way that we want to take care of them. So did you have a comment on that, Dr. Laird?
I also wanted to say that right now we continue to ask people to mask in our waiting rooms, particularly. And I know that's annoying. I know it's difficult, particularly if you're here for a well visit and you feel fine. The problem is we don't ask you necessarily. We might ask you questions about coronavirus, but we don't ask you about all illnesses. And we have people of all levels of health that are in our waiting rooms. So even if it's not for you, please consider masking there for the others that are waiting. And we really appreciate that. We realize it's difficult and annoying. If you don't have to do it at the grocery store, why do I have to do it here? I certainly understand that, but it's a little different here, and thank you for bearing with us.
Yeah, thank you. Okay, well, I think that's going to be it for today. I don't expect 99 of these to follow like we did before, but from time to time, as things come up, we'll provide updates. And again, I'd like to thank Dr. Laird for joining us today. I always appreciate your insight. And I think all of you listening to this need to understand that there are a few others like Dr. Laird who are part of our multidisciplinary team that continues to meet and continues to discuss all of these changes. And really proud of our team and really glad for the information that they provide in a very professional and common sense approach to it. So thank you, Dr. Laird, for being part of that, and appreciate all our team members. So with that, we're going to sign off for today. Thank you again for joining us, and we'll be back in the future as conditions merit. Thank you.